feedback. Just doing one last check to see who may have joined. Looks like Rick. Good morning, Rick. How are you?
You should be live now.
Good morning.
Hey, all right, live stream's going, recording's going. Dr. Wagner, Ray, we can get started at any time you like.
Great. Thank you, James, and thank you to the rest of the team for getting us all set up this morning. That is very nice to have. I wish I had you two. I wish I could contract with the team for all of my WebEx and Zoom meetings that have occurred over the last several months. They would have gone a lot better. So thank you very much.
Well, thank you.
I'd like to welcome you all out to our UETN board meeting this morning. Hope that you're all healthy and enjoying summer as much as you can, as we're, I'm sure, still facing challenges with COVID-19 and planning and looking through the summer and looking ahead at fall, but hoping that you all are having the opportunity to unstring the bow a little bit this summer too and get a little bit of a break. So again, appreciate you taking the time to join us. We have a number of items on our agenda. We actually have a pretty full plate this morning, but we'll keep it to our two-hour block. So we'll go ahead and get started. You have in the board materials, you should have the meeting minutes from our April 24th meeting. And Denise, I believe we have a quorum according to my notes. So we
Yes,
should be able to, great, thanks. We should be able to vote. Unless there are any questions or concerns about the minutes, I would entertain a motion to approve.
I move that we approve the minutes from April 24th.
This is
Thank you.
Pauline. I second that motion.
Thank you. All in favor? Hands are fine.
Aye.
Great, thanks. Any opposed? Okay, thank you very much. The minutes from April 24th are approved. Now going to turn some time over to Ray to talk about some retirement news.
All right, thank you, Robert. I just, like the rest of you, have felt very privileged to have had the opportunity these past few years to work with Gary Caveen. Gary has been a very faithful board member. Prior to being on the board, he was on our steering committee as well. So he has a total of 14 years of service that he's given to UETN. And I would like to be able to share with you this proclamation that we have on his behalf. And Gary, what we will do is we'll print out a really nice copy of this and we will mail it to you. But we want to acknowledge your contribution, the great things that you have done. So it says, whereas Gary Caveen has served 14 years on the UETN board and the UEN steering committee, and whereas his diligent leadership now provides 21st century connectivity and online services to public schools, libraries, colleges, universities, clinics, health departments, and hospitals, and whereas he has thus served students, educators, faculty, staff, librarians, patients, clinicians, and healthcare providers, now therefore the Utah Education and Telehealth Network hereby honors Gary Caveen with this certificate of appreciation dated June 26, 2020. You ask anybody, what do you think of Gary and describe him, and everyone, talks about what a wonderful human being he is, how very willing he is to reach out and serve and help other people. And so, Gary, we do appreciate all that you've done, and want to give you the recognition that you deserve.
Well, thank you. That's very nice of you. I really enjoyed the years I've been able to help and I've learned a lot over those years and worked with a lot of great people. There've been so many really talented people on the board, and then the staff at UETN. It's been great to get to know them, and it's been a great asset for our institution, really, to have that involvement too. It's really helped us here at Dixie, and so thank you. I really have appreciated the privilege of being able to serve on the board.
Okay, thank you so much. We also have another retirement, Deb Lamarche. And Matt, were you going to share a little bit regarding Deb's award? We're not hearing you, Matt.
Okay, there we go. Sorry, can you hear me now?
Yes.
All right, can everybody see this slide okay?
I believe so.
Okay. So we had a really fun opportunity at our last UTN Advisory Council meeting, which I'll talk about a little bit more later. But during the middle of that meeting, we surprised Deb Lamarche, who's retiring from Utah Telehealth Network after 25 years of service. And we wanted to make it a special event, which was difficult to do because we couldn't meet in person. Our advisory council meeting was a virtual meeting. And so we presented Deb with this award, and this is going to be, it's an inaugural award. It's called the Deborah Lamarche Telehealth Excellence Award, which will be presented annually to an individual or organization that's accomplished outstanding work in the field of telehealth. And so Mars Cesarini on our staff drove up to Deb's house in Huntsville and surprised her, knocked on the door during the advisory council meeting and presented the award to Deb. And in his words, said that words can't describe the impact that she's had on telehealth, on our organization, on the staff, and not just in Utah, but in the entire region and across the nation, with all the work that she's done over 25 years to promote telehealth and help people start telehealth programs and be just a great resource and a great person to work with and learn from. So I just wanted everybody to see the award, and look forward to next year when we can get nominations for next year's award in her name, in her honor.
Thank you, Matt. Robert, we'll turn it back to you.
Great. Thank you very much, Ray and Matt. And once again, congratulations to both Gary and Deb and for their wonderful service. And they will certainly be missed, and appreciate them and wish them well as they go on to the next chapters. So thank you again. We're going to move to the action portion of the agenda now. And as we discussed earlier this week, the agenda, we thought it would be helpful. The action item will be our FY21 budget, but as I'm sure you've heard, the legislature has recently made some changes, and so we thought it would be helpful before we take that action item that Ray take an opportunity to discuss a couple different COVID-19 related issues that I think will lead up to our budget discussion. So Ray, if you would like to take that would be great.
Okay, thank you. I want to share with you here, just as a reminder, what our funding request was as we went to the legislature. As you recall, we had just two things we were asking for: growth and operations and consortium software. Under that growth and operations, we had a few different things: new circuits and sites, upgrading the backbone, additional support for telehealth operations, public library connectivity, and then the tools that we need to monitor our network for efficiency and that. So that was the growth and operations piece. And then the consortium software we were requesting funding for was for the learning management system for higher ed at the same level that K-12 has. That's Canvas, and having it fully funded for higher ed like it is for public ed. And then also for K-12, we were looking at the interactive learning platform Nearpod for all K-12 schools. We had a very successful session. Everything was approved. It went to the appropriations bill to be funded fully. And then they decided to take what they had done, and they wanted to do tax reform. And so they converted everything over to one-time funding. And then when the pandemic hit, we were told that any of this new money that was going to be appropriated will not be appropriated. So we did not receive any of the new dollars that they had initially said that we would. So that was not funded. And then on top of that, like everyone else in the state, you all have gone through the same thing that we have. We were also told that to expect additional cuts. Not only would we not receive any of the new funds, but we would also be having cuts to this current year's budget. And so we went to Retirement and Independent Entities Appropriations Committee, and they put together their recommended list for cuts. And that was, they worked with us on this. So we knew what they were really looking at. But these are the three things that they initially said that they would be cutting, and that was $200,000 from our ongoing equipment money, $200,000 one time from equipment. Utah Futures, you'll hear later in the agenda that we're no longer supporting that as of the end of June. And so we had $500,000 there that we were able to turn back. And then any of our out-of-state travel has been canceled for this upcoming year, over $280,000 worth of travel. So we will not be leaving the state for that. Then they said, if worse comes to worse, we'll also have you. We need to cut an additional $875,000, and that would come out of our emergency reserve fund. And so that is an additional cut that they have made. So we are not only lost all the new money, but we also have seen these additional substantial cuts. But that really is not the end of the story, because Lisa and I, we received a call from Executive Appropriations, and they said, we have some of this CARES money that we would like you to consider what you would do with it, put together a list, let us know what needs would be there that would have immediate impact as a result of the coronavirus, and not only would have immediate impact for our state in education, but would also have long-lasting effect down the road. So we worked, Kelly Cole has also been actively engaged, our entire leadership team. We reached out to our stakeholders, to people from higher ed, from public ed, and we generated the list, and we took it back to Executive Appropriations, and they had us tweak it a little bit, but when it came right down to the final action at this most recent special session, they appropriated $125 million for us to oversee and make sure that the needs that we could identify for our state would be met, knowing that there is a real urgency in being able to get everything identified, ordered, and in place and up and running by the end of December. So this isn't you have an all year or you can roll it forward. This is a really important thing that we do right now. And I've assigned Lisa and Kelly to be in charge of this, but obviously my entire staff. This is a top priority for us to make sure that we can meet the needs again of those stakeholders. I'm just going to give a real quick brief, and then I'd like you to maybe go in a little more detail and talk about again some of the cuts that were in addition to what I just mentioned, and then how we're going to be moving forward with this. So network infrastructure, and then we have several things identified. It's in the board packet there. You can read the more specific detail, but a great deal. We identified about $22 million worth of projects that we could have done and completed and moving forward by the end of December, dealing with network infrastructure. The software, that's one of the things I think that we have a great ability to do statewide licensing and contracting for 5-year contracts. So we identified some of the software, and when it comes right down to bottom line, it may not be exactly these pieces of software, but it would be this type of software. So we still have a little flexibility there if we need to. Training, we think that not only do you need the infrastructure and you need to have the tools, the software, you also need to have people that are trained and know how to use it and can use it effectively. We have many students, especially at the higher ed level, who do not have laptops, surprisingly. 5% have been identified as not having laptops. So we felt that we needed to be able to order some and have them for the higher ed institutions to check out to those students on an as-needed basis. Additional support for telehealth and meeting the needs of those whom we serve. And getting ready for fall classes, making sure everything's in place, and then doing some of the summer courses that are already in place on that. We did identify this area here for those families. Utah is a really well-connected state, and we have about 90% of our homes have access to the internet, but 10% do not. And of that 10%, there's estimated approximately 5% choose not to have the internet in their home, but 5% just it's the inability to afford internet connectivity. So we're still working on this piece and trying to come up with a way that we could address the needs of some of those students to be able to have internet connection at home, and working with our telecommunication partners in finding a way that we could help with that. So that's really what has happened regarding the session, what our initial requests were, some of the cuts. I think, Robert, this time if we could have Lisa kind of explain perhaps a little bit more on some of the cuts, additional cuts, and then go into the how we're going to manage this, what our plan is, and then moving forward on the board looking at the budget.
Great, thanks.
Okay.
You want me to take mine off, Lisa? You'll put yours on?
Yeah, I'm going to share right now.
Okay. All right, there you go.
I'm doing it right now. So when Ray actually brought up, okay, right here, I'm actually on this one just showing a little bit more about the cuts that happened, and it's exactly what Ray said. They did cut right here under column G. They column F and column G was to reflect the new funds that we received. One thing that happened at the beginning of the fiscal session was they actually converted, and this is column F right here, they actually converted our funds from fiscal year 20 that were given to us as one time. They did convert them back to ongoing, and that happened at the beginning, Senate Bill 5. And then what happened was then the funding for our request that Ray went over was also appropriated. And so that went well. But what happened was there's a new bill, and this is where they started to do all the cuts, and it's called Senate Bill 5001. And it shows exactly what Ray said, that they took back all the funding that they awarded us for fiscal year 21. They also took back, which I was a little surprised, was the funding they converted at the beginning of the session under Senate Bill 5 that they converted to ongoing. That was also taken away from us, along with an additional, which would be mainly travel, and an additional $332,000. During that Senate bill, they did go ahead and they funded us the $125 million, which was the CARES Act funds. But for UETN, our operational budget at that point was, it was cut $9.2 million. A lot of the, and this affects, so I think I want to, regarding the software, this affects some of the software we were looking at buying, the Nearpod and the Adobe and the Canvas. Those are the ones that had affected us for fiscal year 21. So I'm reflecting the budget with the cuts being made from Senate Bill 5001. I did include the $125 million for the CARES Act, which has a specific, that does not affect our operational budget, because we have, as Ray just shared with you, the CARES Act where the funds will be going. We're asking for approval for the budget with the reflect of the cuts that occurred in Senate Bill 5001. And a lot of these were our infrastructure projects, and those we have already gone forward with those, and we will pay them out of our emergency reserve funds, because that's our only choice. So we are going forward with those, but it reflects what happened. So does anyone have any questions regarding the budget? There were a lot of cuts going through, and I think the thing that surprised me most, so y'all know, was I was surprised that they did cut the funding that they converted to ongoing at the beginning of the legislative session that became part of our base budget. I was a little surprised with that cut. I wasn't expecting that one, but they made the decision to cut it.
Ray, has there been any discussion from the legislature about future interim sessions and possibly recovering any of that? The idea of a motion today on the budget is that, you know, we'd like to have a motion to approve the budget, but also with some flexibility that there could be some changes too. Ray, could you or Lisa talk about potentially, have you heard anything of what those changes might be?
I think most legislators are saying that there will probably be additional special sessions as we move forward and we get new revenue information, you know, as a result of the coronavirus. I think they're going to be willing to call themselves into session, you know, 2, 3, 4, however many more times they need to make sure that things are taken care of in a timely manner.
And the cuts that occurred for the funding request for fiscal year 21, that happened to every institution. UETN was every higher ed institution, all their funds taken away also, and it would be readdressed later on.
Maybe Tammy could speak to that. You know, coming from the governor's office, or maybe she needs to keep mum. I don't know.
No, I did have a question. And yes, other institutions and across the board, lots of people, everyone had cuts, let's put it that way. Yeah. The question for you was, when the CARES Act funding that you received, was there not a maintenance of effort clause in there that you can't use those funds to supplant, or do you feel comfortable that we've not done that? I know it has to be a certain threshold, but how have you addressed that? Because we've had that issue with our K-12 CARES Act money, the ESSER and the GEAR funds.
It's not meant to backfill funds that were cut. And that's been the really hard question. And we do have a couple questions in the governor's office right now regarding software. In particular, it's regarding, and we can go back to the list. I was going to just show a little bit more detail regarding the CARES funds, but regarding Nearpod and Adobe K through 12, I've got that. And I've been working with our legislative analyst on the governor's side. And he, because there's some dates involved as to when your fiscal year 21 had been approved. And I brought up just some issues that I felt like it wasn't approved till the governor signs it, which is but it's a big deal. That's become a big deal, and I don't have guidance on that yet. But I did ask for guidance from the governor's office. So.
Okay, but our office wasn't questioning the use of or supporting Nearpod and Adobe, correct? And I'm not aware, but hopefully they were not questioning.
They were where it gets in question. I go back down to is the guidelines they've given us for the CARES Act, and they actually tagged those two because I gave them the list of what we're doing. They tagged it. I said to them, they said the deadline was March 27th for the budget being approved. I said the governor did not sign it till March 31st. In my eyes, you do not have an approved budget. And I would just like them to support me saying we agree. But I could tell you I have not gotten that answer. And I've been hounding him with. I'm embarrassed. How many times I called them this week?
Lisa, will you send me an email as a reminder? Because we're really, this is a common answer I give people is that, the legislation passed, but the governor hasn't signed it yet. Or it hasn't gone into law without the governor's signature, but the same dates would apply. And so I'm totally supportive of that. Let me know and I'll just make sure we iron out what we need to.
And that's where I was actually going to kind of run through what we have sent out to everybody regarding the CARES Act. Okay. That date is so important to us, and I want the backing of the governor's office that they're going to support us on this because in the end they did. So anyway, but regarding the budget itself, that's what's happened right now on this continent.
Thank you.
Are there other questions about the FY21 budget?
I just had a quick question. I know Ray talked about it a little bit, but I'm very interested in the access for these students that don't have internet in their homes. That's a passion of mine, so I'd be interested in any further information we can get about that, and if the board's going to get an update on what kind of solutions we're entertaining there.
Is Ray on? I saw Ray step away.
Dave, this is Laura. I can give you a quick update. There's a committee that just met yesterday that's working with Sarah Young. I think you're aware of. One of the things we're looking at is what other states are doing to address this issue. Checking out hotspots through public libraries is an option, and I have a meeting next week with Colleen from some folks from your staff to explore that. There's a pretty successful program that Arizona did with checking out hotspots for needy families. So we're just exploring a lot of options, knowing that whatever we do, we have to get it complete and out the door by the December deadline.
That's good to know. I just know that lots of school districts are wrestling with this, and we may have some experience with that in state that could be helpful to that conversation. And I'm talking canyons, and we've done some things here in the rural areas, but there's a number of us that have tried some things, and some success and some not successful. So I'd love to be part of that conversation.
Sure, and I'll just, thank you. I'll just add one of the tricky things that we're starting to understand is if we enter into any different contracts with the telcos, there's some concern about E-rate regulations and how it might affect E-rate. So we're trying to learn as we go and tread very carefully with that because we wouldn't want to do anything to jeopardize E-rate either. But yeah, it's a moving target. Thanks for your offer of help. That's appreciated.
Yeah, the state would love to help with that project. I know that there is distinct need, especially out in the rural areas, for people to be able to check out these types of things. So thank you, Laura.
Yeah, I was telling the committee yesterday, even Salt Lake Library, I looked up, they have 24 hotspots and those are all checked out and there are 36 people on their wait list to get one. So yeah, even in the urban areas, it's an issue too.
Other questions or comments? Okay, with July 1st next week, I think UETN would appreciate us taking the FY21 proposed budget as an action item. So I would entertain a motion at this time.
So moved.
Thank you. Is there a second?
This is Gary. I'll second that.
Thank you, Gary. Any other discussion? Hearing none, those in favor of approving the FY21 budget, please raise your hands. Any opposed? Thank you very much. The budget is approved. We will, Ray and Laura and Lisa, we'll look forward then to getting some updates, hopefully by the August meeting then on, especially with the CARES Act funds and how those funds will be able to be deployed.
Okay, thank you.
Okay, we will move on to the discussion portion of the agenda now, and with the strategic plan update, we're going to turn to Laura.
I'm just going to pull this document up right now. So there's two versions of the strategic plan in your materials. There's a markup copy that shows the edits, and that's what I have on my screen. And then there's a clean copy, so it's a little bit easier to read. So just to bring everybody up to speed, our strategic plan was 2015 to 2020, and we did do some updates to it in 2018. So it's ready for another refresh and update. And originally we had planned to have a full day retreat and do a lot of time with this, and then you all know what happened with that. So we're now looking more at just refreshing it and making sure it reflects the projects that we're working on. So what you have here is a draft version that has been to both the UEN Advisory Council and the UTN Advisory Council, and they've had input into these edits. And I don't want to take too much time for this meeting. Our plan is that any additional edits would go through you all. Other people would have a chance to provide input, and also with the staff. And then we would bring the plan at the next meeting for approval by the board. Robert, I'm not sure if you want to have any specific questions about each item or what would be useful.
Well, it is available for the board to look at, so maybe I would just ask and see, do any board members have any questions about the proposal thus far, the plan, I should say. Okay.
I just have a quick question about it. As I went through this, and I've looked at this with some other board members as well, it just seems like it's more of an outline than a strategic plan. I know it lists all our projects, but I was wondering if we're going to get a little more detail on what's connected to the items in the plan here.
Yeah, good question. So this really is the strategic initiatives, and then there is a project plan, of course, underlying each of these, or even several, because some of them are multi-year. So we don't really have a tactical plan that we put forward for this purpose. It's more of what are the larger strategic initiatives, and then of course reviewing the mission, the values here at the bottom that guide all of our decisions, and then some of the performance measures that go along with all of those. Dave, did that answer your question?
Yeah, I'm not looking for a bunch more to read, but I was curious to see if there was a way for us to, as board members, to just look at some of those other portions of the plan.
And can I do a follow-up to Dave's question, which is, I guess I am doing it, so, which is with the performance indicators, can we have a baseline on what they are now? So that we know what the scope of that indicator, the scope of the work is?
I think that's a great idea. So I'll make that note to add that. I'm not sure if there are any other questions, but we welcome your input if you want to send a message to anyone in the leadership group, or at the next council meetings, it'll also be on their agenda as well.
And so, Laura, did I understand then that will you communicate with the board with these proposals then before the August meeting? Is that the plan, or do you want to talk about timing again, just to clarify?
Sure. So, I mean, we're available anytime. So if you have edits or suggestions from any board members, you're welcome to message anybody on the leadership team, and we'll make sure that we bring those forward. And then it will be on the agenda for the 2 advisory councils in early August, prior to the board meeting in August. And assuming that there aren't major changes and the board is comfortable with it, that's when we would have it listed as an action item.
Okay, great. Thank you. Any other questions?
Yeah, I have a quick question. This is Tad. Just on the performance indicators, I'm looking at the top one, 100% of sites connected at sufficient capacity to meet need. Do we have a timeline for that goal of when we are shooting to achieve that?
Yeah, good question. I think it's kind of a rolling timeline because need is always changing, and the number of sites and the types of sites we're connecting are always changing. So it's more of a target that we try to meet and then track if we're meeting that target. It's something that we report to the legislature every year as part of the COBE report. So it's not really a specific timeline, but it's an ongoing target.
I guess I'm reflecting back on the report that I saw for community health centers and their bandwidth, and there were many that were identified that were insufficient. So we kind of knew where we were falling, where they were insufficient, and I'm just wondering if we have. Are we making progress? What is our goal to achieve that? Because there were a number that were already pretty inefficient or insufficient, I should say.
So I can respond to that a little bit. This is Matt. On the healthcare sites, we just finished an RFP and we're submitting USAC applications for funding for circuits. And a number of those, probably half of the ones that we're submitting, are for upgrades to bandwidth, not necessarily new sites, but we have 2 more years, and then we need to redo all of our circuits, which will be a really large project. But as we do that, we plan to survey all of the sites and see what bandwidth they need, probably for the next 5 years, so that we make sure we're continually providing adequate bandwidth. As Laura said, it's always changing, and as they add new equipment and more devices, then the needs go up. But we are submitting applications for higher bandwidth as we go.
And Patty, I saw that you had raised your hand.
Yes, first I wanted to say thanks for all of those who did work on this. I know that any of these things do take at least a full day in going through, even though like the edits seem small, each edit takes so much thought and time, energy, and effort. And I was especially appreciative of the vocabulary. I do have to tell you that I looked up 2 words because I didn't know what they meant. I'm not going to tell you guys which words those are, but so love that. It helped me learn and grow as a professional. But what I was, and this maybe goes back to Dave's comment and perhaps Tad's as well, which is with the performance indicators, I wasn't sure the supporting documentation that went with it. I'm sure each one of those indicators has a plan of 75 pages that goes along with it, with supporting staff and all of that. So when I was mentioning before the benchmark, where are we at? And then there's some more conversation added to it about the timeline. Maybe that's something that could be provided, which is here we have a strategic plan, or I'm sorry, it's not the plan, it's the strategies. That's the, what is your word, Laura?
Plan.
Okay. With each one of those, if we have a 5-year plan, then where will we be at in year 1, so that we can see where we're at with each benchmark, and then what extra effort we have to put in order to achieve the goal by 2025. If we have moving indicators, such as item number 1, where are we at right now? And then as we move forward, we could say what's added on. So then we have that feeling of success, which anyone working on a project can say, yes, we've come this far, but then what else do we need to do, and adding some things on. So that's kind of what I was looking for, but I was assuming that that might be somewhere else, but I didn't know where it was at.
Sure, and thank you. I mean, I think we can always be better at that, and I really appreciate the input. So we also have the dashboards that are on the UEN website. So if you do uen.org/dashboards, we have visual dashboards that go back 5 years. So from the first time that we did this plan, and we do have metrics on the dashboards for most of these things. We don't have them for some of the telehealth things, and we don't have it for the savings through consortia purchasing, although that is reported separately. So I think the message I'm hearing is to be more clear about where we are at key points in all of these, and show how change over time, which I think is great advice. And then we can also the board could ask us to highlight any of these at an upcoming meeting. So if you wanted a deeper dive into one of these performance indicators to get more detail, we can absolutely put that on a future agenda.
Thanks, Laura.
And I would like to add, I'm still holding out hope that eventually the board will be able to get back together again for an actual strategic retreat. And whether or not it's in the next year, I'm still holding out hope that that would be the case when Laura and Ray, I'm sure that this would be a major agenda item, would be to discuss this more. So we appreciate the fact that it's technically expired this year, and it's important for the organization to have something going forward, but I do look forward to the time to have a much deeper dive.
Agreed.
Absolutely.
Any other questions? Okay, and again, I would just invite members of the board, if there are specific topics in this plan that you would like to take a deeper dive on per topic, please feel free to let me know. I'm sure that you can email Laura as well as Ray, and we will look at getting it on the agenda for a next meeting. And if we aren't able to take a deeper dive to look at the whole plan, that might be how we do this going kicking sorties into different sections of the plan. So feel free to look those over and let us know if there's more that you would like to discuss. Let's go on to the next agenda item, which Matt will be talking about telehealth security update. Matt.
Okay, thanks, Robert. Let me share my screen again. All right, can everybody see that okay? Yeah. A thumbs up. So one of the big projects we've been working on is relating back to the Burwood group and their report and recommendations on the telehealth services. And so we've talked to the staff, we've gotten a lot of feedback. We've talked to our advisory council members, member sites, and I've just, especially since I'm new, I've just asked a lot of questions to understand how telehealth services can be better integrated with within UETN and how we can be more efficient. And so we've started to make a plan, and we just wanted to share the plan and the vision with the board so that you're aware of what we're doing and the impact that it's having and the positive impact that we hope that it will have in the future. I've just listed here kind of a high level of some of the items that we're working on. The first one is to integrate the UTN technical staff. So that's our network and security engineers into the technical services department more effectively. And so what we're doing with that is actually taking our 3 engineers and we'll eventually be moving them into the security department. And we're looking at how we can restructure and reorganize the security department so that all the security services that we offer for both healthcare sites and education sites are unified in one security group, one security department. The second thing is we're looking at creating a more formal telehealth services department with a formal structure and scope of services, and taking a hard look at what services we offer and what the needs are of our member sites. And one of those needs that we've identified is to reduce the focus on network and technical aspects of telehealth and start to increase more of the focus on the operations, the training and education, supporting new telehealth programs, and being a neutral convener for the state. I'll give one example. Last Friday, we convened a meeting of telehealth providers across the state of Utah. We had 33 people represented: Intermountain Healthcare, University Hospital, Ouch, the federally qualified health centers, the Department of Health, a large group. And we talked about what the needs are and how COVID-19 has impacted healthcare delivery in the state and telehealth. One of the things that came out of that meeting was the need for us, the Utah Telehealth Network, to help providers understand payment in the state, how to get reimbursed for telehealth services. So having us have a good communication in place with the different payers, the third-party payers, and putting on our website best practices for how to get paid for telehealth. A lot has changed. The payment and billing rules have changed. The policies have changed because of COVID-19. So we want to focus on that role that we can play and help healthcare providers in the state. We feel like this will really improve culture and job satisfaction of the staff involved in these changes. And we also want to do a better job at coordinating Universal Service Fund efforts within UETN. So both the E-rate program and the rural healthcare programs, and how we work with procurement and doing our RFPs, and having it be a more coordinated effort. We've assigned a project manager from Jeff Egley's team, James Brown, to help with this project and make sure we're completing things on time. We have a process, and he's been great to work with, and that's been really important to have his efforts, so that these talks don't fall through the crack as we're all busy, but we really stay on track and make these changes and have a positive impact. So are there any questions? That's kind of a high level overview of what we're doing, but just wanted to make everybody aware.
So this is Tad. I've got a quick question. So I think that one of the key roles that UTN has played is the maintenance of the network and the technical support that has been provided to the clinics and the rural sites, and kind of getting back to the bandwidth issues of, looking at some of those insufficient areas. While I understand and completely support the increased focus on operations, I would say that one of the fundamental and foundational values that UTN has brought is that maintenance of the network, and really helping bring the pipeline, I guess, to areas that are underserved or don't have other resources. So while I support these initiatives, I would just not want to abandon that focus. When you say reduce, that gives me a little bit of unease. I think that's an area that's really important and of great value that UTN brings.
Yeah, Tad, that's a great comment. Maybe that wasn't worded the best way. In our advisory council meeting, which I'll talk about in a little bit, we did some planning and listed some goals and priorities. And the number one priority for UTN staff is to maintain that secure and reliable network for our member sites, and especially those in those rural areas. So it's not necessarily not providing that service anymore, not focusing on that, but it's more having our engineers more integrated into tech services and the resources available there, and having staff to help do the telehealth, the training and education, and the actual telemedicine work that we do. But that will always remain a core value, is focusing on our network connectivity and the value that provides to our sites.
Thank you. I think that's really an essential service that you all bring. So thank you very much for you and your team and what you do.
Thank you. And we heard that some of the community health centers told us clearly that that the discounts and that service of the network connectivity, they honestly might not be able to exist without that. And we heard that from a lot of them.
I don't want to be wordsmithing, but you may want to say something like maintain focus on network and expand focus on operations. So you're kind of, you state that you're keeping that focus, but expanding in other areas.
Yeah, good suggestion. Thanks.
Okay, anything else for Matt? Okay, thank you, Matt. Appreciate that. We will now move on to Max. This is one item that we didn't get to in our last meeting. So Max, thank you very much for your patience, but we'll be looking at the UEN app.
Great. All right, I'm going to share my screen. Let's see, sorry, 1 minute. All right, hopefully you can see my screen. I'm going to take that as a yes. Awesome. So if you could just ignore the rest of my desktop and well, let's see if this works. This actually might work better. Hopefully you can still see my screen. About a couple months ago, we launched our UEN app, which we're very excited about. This is a preview of it right now. The purpose of getting this app was to pretty much have an extension of the UEN resources. And because of that, you'll notice a lot of the resources we feature on the app are resources of the public sees. So you're going to notice that it's very broadcast heavy. It's very heavy on the online web resources, etc. I'll give you a quick tour of the app. So it's basically broken down into 4 different sections. The first section is our main menu section on the left right here, where we list the majority of our online resources here. And if a user clicks on one of those, it'll take them to a web browser that has these resources. There's also miscellaneous resources where they can create a ticket for us if they have a need, give us general support and feedback, etc. The first main tab here is the Watch tab, and this is where we feature our visual content. So as you can see here, you can view our latest content that our production team has created. You can see an overview of our broadcast schedule. We link directly to our YouTube channel, and then on the bottom here, we feature the latest playlists from our production team, such as PD videos, our Learn at Home series, Art Connection, etc. And then, of course, we have links here to all our major social media accounts and our newsletter. In addition to having this for UEN, we also feature it for each of our channels. So if a user is interested in content for our FNX channel, let's say, they can view locally created FNX content directly from the app. The next section is our schedule section, where a user can look at our schedule online. So for instance, if they're interested in seeing what's on now, they can just click on this button, what's on TV now, which will bring up our current schedule, or they can view what's on later at prime time. Another cool feature of this section is, let's just say a user wanted to get a reminder notification that this series is on later at 8 p.m. They could just click on this remind button, and the app will remind them at that time that their program is on. So if they want to watch something on TV later, that's a good resource for them to remind them that it's on at a certain time later on. And in addition to having our UEN TV schedule, we also have the schedule for FNX and NHK World Japan. The final section is our general resources section, where a user can see kind of a layout of general resources we have to offer online. So this is broken down into 2 categories, our professional development and our general education resources. With professional development in this section, they can listen to their podcasts that's produced by the PD team within the app, so they don't have to go anywhere else to listen to that. They can view it and see the latest episode and information right here within the app. They can view the latest episodes from UEN PD TV. They can also view a schedule of professional development events, view their course catalog, sign into their catalog login, and request a presentation. In the general education resources section, we feature our main resources within uen.org. Some highlights here would be our new Launch My Career resource. And then a fan favorite of UEN, which we've moved to the app, which is Reality Check. This is a product that used to be part of Utah Futures, but since we've retired that website, we've moved Reality Check into the app, exclusively within the app. Another great component that's useful is that we have the ability for a user to give us audio feedback. So if they were to click on a prompt here, it would give them a question. They could tap this microphone and then leave a message for us. And this feature could be useful in the future for reports or user stories. It could be useful for when our PD department is in the field and they need to use a story or somebody's given them a compliment. They can use this resource to record that audibly. And of course, we've linked to all of the, again, social media accounts here, as well as the newsletter. In addition to the app in general, there's some great backend features, some of which are we're able to do push notifications, which we only do about a couple times a month. But if there's something major we want to push to our users or let them know about, we can send a message to the backend and they'll get the notification on their phone that something's happening. We can link them to any relevant links they might need. We can also do campaign notifications. So let's just say we were having an event or there was something a user needed to know about for a specific period of time. We could add a banner across the whole app, letting them know the message we want them to know, which is another cool thing we can use later on in the future. And that's the app for you. Are there any questions about the app in general that I could answer?
More questions?
Great.
What a great resource. And that just looks great. Thank you very much, Max.
Of course, we're really excited about it. Happy to help.
Yeah, that is great. Okay, we will move on and we'll turn some time to Laura now for the Utah Futures exit.
Well, I have to say this is the one that Robert said we should just have a moment of silence. But since my neighbor is mowing his lawn, we won't have silence. So, so here's a quick reminder that Utah Futures that we've been in charge of for the last 4 years, we have 4 days left. So at the end of this month, the whole website will be retired and users will see a notification about that when they go to the website. During that process, we've also been able to relocate a lot of the Utah developed resources to a UEN webpage called uen.org/career. And then the licensed resources, we've exited all of those contracts. There are a couple licensed resources that some of our partners are taking over. The biggest one is that the Department of Workforce Services had a lot of integrations with the resume tool and the way that they track unemployment and services for their clients. So the Department of Workforce Services has taken over the contract on the resume builder and the cover letter builder tool, and they'll manage that exclusively. And I know that the public libraries are also looking at possibly licensing the Learning Express library in the future. So the other reason that I wanted to bring this to the agenda is because Max is online, and I wanted to make sure that all of you board members know Max is the IT project manager that has managed Utah Futures for the last 4 years. And I'm sure you can imagine how difficult it is to be enthusiastic and professional and produce the kind of work that Max has produced, knowing that you've been operating on one-time funding year after year after year. And so I wanted to publicly acknowledge the great work that he has done He's leaving it on a very high note, as you can see, moving on to other projects like the app that you just saw. We've had a good walk down memory lane, remembering the 6 months that Max oversaw the project to fix all of the back button issues. Yes, that happened. And the growth has just been phenomenal, and we couldn't do it without his great leadership in that area. So thank you, Max, for all of your hard work. And we'll either have I don't know, a sad moment or a cake, I don't know, at the end of the month.
Sounds to me. Thank you. Happy to help. And it was a great team effort as well. So again, special thanks to Laura and Jamie, our trainer, and David, our developer. It's an amazing team, and I'm excited to work with them more in the future.
I'd like to say that this has been an amazing project as well. The public libraries around the state have gotten great use out of the many resources that have been on Utah Futures. It's been a tremendous benefit. And so I'm looking forward to carry part of that forward a little bit. And yeah, I think a moment of silence is going on for us at the State Library at this time. And thank you, Laura, for your great work on it. You've done a lot of good work over all of these many years. And I just really want to pay tribute to you for the many things that you've done to make this possible. Of course, I wish it was back in your camp again. I would root for that if that could ever happen. But nevertheless, thank you for what you have been able to do.
Thanks. That's nice. That's it for this.
Laura, you had suggested maybe a cake. I was thinking of a wake. So the real sad goodbye and a real happy time. Utah Futures has bonded us together for a lifetime. So thank you for all that you've done for all of you, Max and Laura and Ray and everyone on Utah Futures. But it's off to a better place.
Tammy, and to you as well, and to Karen, thank you for all of your efforts. See you at the wake.
Great, and I would add there are some very nice comments in the chat room also, so thank you very much for all of the work. Okay, we will go on now. We have some reports this morning, so we're going to first have our advisory council reports. We'll start out with the UTN advisory council. Matt.
Okay. Share my screen one more time. All right, everybody can see that. So the advisory council did meet recently, and I've just listed some high-level things that we covered. We had a discussion about the impact of COVID-19 on the state and healthcare providers. Some of the items that came out of that discussion was a need for a coalition with payers to understand and hopefully standardize billing processes. There's still a lot of confusion about how to bill for telehealth services, especially those regarding testing and treatment for COVID-19. There's a really large need for virtual mental health services in the state. I have some data I'll show you about that. And then also nursing home. As we know, it's been hit, nursing homes have been hit very hard by COVID-19. And telehealth has changed a little bit in this area. You know, the history of telehealth has been more site to site, you know, a rural site connecting to an urban specialist specialty site. And especially in nursing homes, they're starting to use telehealth internally. So rather than having nurses go into rooms and be exposed, they're using carts, leaving carts in rooms and having nurses visit with individuals virtually inside the nursing home. And there's some needs for best practices and training on how to do that. As I mentioned, we recognize Deb and that was a neat experience to surprise her with that recognition. We are also still completing HIPAA training for all of the UTN staff and also all of technical services staff. So we're at 81% complete right now. We had a long discussion about goals and priorities. I have a few slides about that. We talked about the Northwest Regional Telehealth Resource Center. We recently got an additional $828,000 in funding from the CARES Act. In fact, all 12 telehealth resource centers in the nation received that additional funding to expand our ability to provide education and training and assistance for healthcare providers using telehealth. And in conjunction to that, we have hired 2 new staff, a program director and a program manager to help lead our efforts as a telehealth resource center in our 7-state region. The last thing we did as an advisory council was a review of the UETN strategic plan. So real quickly, from our discussion about goals and priorities, we identified some things that the UTN staff can focus on. And then we also identified some things that the advisory council would like to focus on. I won't spend a lot of time on these, but as I mentioned, number 1 was maintaining a secure and reliable network for our member sites, developing best practices, education and training material for healthcare providers, facilitating better coordination between entities, helping providers understand how to get paid for telehealth, and then inventorying the education and mental health space and usage of telehealth. At a future meeting, I'll share some results of a survey I'm doing right now to understand the needs of school nurses and mental health counselors in regards to telehealth and being able to treat and visit with students remotely. And there's some great models around the country where they're having success in that area. And then, as I mentioned, the integration with UETN technical services is another priority. The council identified these priorities, an opportunity for a coalition with payers in the state and more consistency, standardized processes, scaling interstate processes. Probably the number 1 question we've been getting lately is from out-of-state healthcare providers who want to treat patients in Utah. And that's allowed right now during the public health emergency, but that may change once that ends. Focusing on mental and behavioral health services, advancing teledental work, and reaching those rural communities with outreach and collaboration. So those are the priorities. Really quickly, I can do this in 30 seconds. I want to just show the board 3 slides about the usage of telehealth in the last few months. This slide is a national level data, and this area highlighted in red shows the change in the volume of claims submitted from 2019 to 2020 regarding telehealth. It's basically increased over 4,000% nationally. And I think that's not surprising, but it's nice to see the actual numbers and see the increased usage. This slide actually shows state of Utah data from the all-payer claims database in the increase of telehealth visits among healthcare providers from 2019, which is the blue line at the bottom, to 2020, which is the orange line. So monthly, around probably 200 to 300 claims to over 2,000 claims. And we've asked the Department of Health if we can continue to monitor this data on an ongoing basis. The last slide, and I shared these with our advisory council and we discussed them, but this slide includes mental health in the total visits. So you can see that all other telehealth visits are around 2,000 visits per month right now, and mental health is 4,000. So it's actually a little bit more than double. And we've had a lot of conversations about what this means in terms of access to mental health services, and also in the schools, and having this discussion with school counselors and how they can leverage telehealth. So a lot has changed. Telehealth has really expanded in a big way. So it's exciting. It's exciting to see the growth in the numbers. But that's my update from our advisory council meeting. Any questions from anybody?
Great work. Thank you.
Thank you.
Thank you, Matt. We'll now hear from the UEN Advisory Council. That report will come from Rick.
Hi, everyone. Matt, you make me look bad. You've got all those nice slides, and I don't have one. So, but it's a pleasure to be with you. We did meet just a few weeks ago, and things have changed even in the few weeks since we met. We did have a pretty robust discussion regarding the budget and some of the changes that were coming down. And as we as we saw the budget report that you received, there was a lot of changes from the first of the month to the end of the month. And there's some exciting things that I see in the, in the budget that you passed earlier, and some of the things that were discussed there. Like you, we also took time to look at the UEN app, and like you, the advisory council was very pleased with that resource, and to get, part of the goal now is to, let our constituent groups and that know about that app and to take advantage of it. So hopefully, in the time that you were in the meeting today, you've taken your phones or your tablets and you downloaded the app to them, and you'll take some time to look at those as well and to let others know about that resource. We also just had some video recommendations, and I think it's one of the things that I really liked that UEN did, and it didn't really highlight that today, but Michael Hackeranian and several on the UEN professional learning staff decided to do a take on some good news. The videos that started appearing during the pandemic and the closures and that, and make their own version of that, and just to do some good news stories on Utah and that. And they talked about, there was two very great stories. The teacher and administrator from Whitehorse High School was featured, and all the work that they had been doing to help kids, particularly in that area, during the closure and that, to be able to continue education, and the great effort that this particular principal and teacher took to help those students in that. I think one of the more touching ones was a video of a young child who had learning to read, and then they had a video of him reading to his teacher for one of the very first times. And it was good to hear some good news during a period of time when there wasn't a whole lot of good things being talked about. And I think that's one of the things that we did as an advisory council. We did take a little bit of time to celebrate the efforts that have been done. The pandemic is, and the school closures was fairly remarkable. If you, and I've said this in many other locations, and I've talked to my colleagues in other states and that, what happened in Utah was not the normal, where we transitioned in basically 4 days, and there was a lot of things that went on behind the scenes, and that was some of the things that we talked about, during the advisory council. It was just some of the things that had to occur behind the scenes. UEN stepping up and within less than a few days, really bringing up the Learn at Home resources, so that there were resources for teachers as they had to transition, and that continued to have things added to that, and but also the professional learning team had to make a complete transition and created all sorts of videos and resources that would help teachers in just one small thing, just these little nuggets of information, and how they worked with districts and schools that had technology specialists, mentors, coaches, and all of the resources that were put together and made available and shared with each other, so that teachers could have support when they were at home as well, trying to work with their students at home. Certainly, we were not perfect, but I would put our efforts at the top of at the top of everyone, and anywhere that way. And we could not have done that without the efforts of UEN, both on the technical but on the instructional side, of everybody being focused, kept schools open, kept learning happening, and just can't say enough good. So that was some of the time that we took, was just to celebrate. We talked about home broadband, obviously, and obviously we didn't hit every kid that needs it, and we're going to see some efforts, obviously, looking at the budget and some of the funding that's coming for CARES Act and that, to be able to even improve in that area. But let's not forget all the good things that did happen, and creative solutions that were being worked on between UEN tech staff and some of the districts. The project in Murray, to be able to create an LTE network and to be able to connect 85 families in one apartment complex, so that those students would have access to the internet, was just one example of that. But we're also working with the efforts of Kelly Cole, and working with all of the rural telcos, and getting kids connected. And we had over 3,100 families that were connected to the internet at no cost to them during the rest of the school year. And so there was just lots of really good things, and I thought that was the opportunity we took at in this advisory council, was to celebrate a little bit, because what we have gone through, nobody's gone through before. When we were meeting back in March, just prior to all of this happening, we thought maybe we might see schools closed for a day or so, maybe for a snowstorm. Nobody ever imagined what we would have to go through and all the things that have happened. And I think it is a time to celebrate. And our constituent groups are all working together. And really, I think, UEN has been a great unifier in being able to help education continue at all levels. So that's our report.
Great. Thank you, Rick. Any questions, comments? Okay. Thank you very much. And Rick, I agree, there's some nice comments in the chat room too. So thank you for reminding us that it is a time to remember and recognize the things that we are doing well and people that we are serving. So thank you very much. We'll now have our technology working group report, and I believe Jim will be giving that.
Well, Gary's here, and I think, and if you want to say anything, Gary, please feel free to jump in. So we did this earlier this week, meet as a group, and we talked about three things that were on our agenda that we spent most of the time talking about. Top of the list was a couple of years ago, we put in the Rubric data backup and recovery system, and it's a very good system, very easy to use. And so we wondered if there might be something that some of our stakeholders would benefit from. And we've had a pilot going now for well over a year, and it's been successful. We're concluding that pilot and preparing to bring to the board proposal to make that a service. And so we ran that by the TAC group, and they were impressed with it. They gave us a lot of encouragement and documented that, and we'll be sharing that with the board in the future. We also had a chance to talk about the LTE private access pilots that are going on. We do have 4 districts around the state, Kane, Beaver, Millard, and San Juan, that are involved in this pilot, and they're purchasing equipment and placing that in one location in each one of those districts. And we're providing some expertise, and we've gone out. We did meet in Delta a few weeks ago, and Jason Ayer from Murray District helped us with some equipment, the radios there, and we're proving out the distances that they'll go and looking for use cases. So we reviewed that with the TAC. And we also talked about changes in the TAC where we've recently concluded that we don't need to be quite so stringent in the way that we've handled that. Laura's let us know that we're not really subject to the open meeting laws, and so we're going to be a little less formal. We're going to still continue to keep minutes and to publish those and to do things like that, but we're not going to be quite as formal as we've been in the past. And with Gary leaving, we have one more meeting where Gary will be part of that, but we have really enjoyed Gary's participation from the board, and we took a few minutes to thank Gary and to acknowledge his service to us and to talk about our feelings for that service and appreciation to him for all that he's done for us. So thank you, Gary.
Thanks.
And that's really our report. Are there any questions? Or Gary, do you have anything you'd like to add?
Nope, that was a good report on the meeting.
Okay, any questions or comments? Okay, thank you, Jim, and thank you, Gary. We will now have a recent media productions report by Laura.
Thanks, Robert. It's actually not a report. I think just a reminder that our production team has been working diligently from home, and although they would love to be out in the field, they have not slowed down with their productions. So I put some of the most recent productions on that information item in board docs, and it's also on our YouTube page, and I would just invite you to watch it when you're able to, and then also share it with your constituents. That's all.
Okay, great. Thank you. I believe, Rich, you are going to give us some upcoming calendar items.
It looks like I'm not going to be able to present on that. I've asked Susan Cohen to pitch hit for me on that.
Hold on. I don't have that up right now. Why don't you come back to me?
We are nearing the end of the meeting, so we do have one calendaring item for the board. You will see our next meeting scheduled for August 21st from 10 a.m. to noon. We anticipate that will also be a web conferencing meeting. So if you could please have that on your calendars, we'd appreciate it. Susan, other items, calendaring items?
We could send that out to board members, Robert, if
Not
you
at this time.
so.
Okay.
It's not at this time.
Okay, great. Is there any updated calendar items? As Ray said, we'll just get those out to the board. We have reached the end of our agenda. Are there any questions or comments or things that the board would like to bring up, or the staff?
Yeah, this is Steve Hess. I just wanted to ask Patty Norman, are the public schools going to be open in the fall?
Sorry, that is the plan for public schools to be open. What that looks like is what's being decided.
Okay.
Robert, can I make a comment?
Yes, please.
I just wanted to thank everyone involved with, and Patty and Sid have had this experience too. Early on, as we started to transition to distance learning, we would meet and visit with partners or colleagues across the nation. And it was just always so impressive to see how far ahead Utah was in the transition. I mean, we transitioned in like 2 days over a weekend, and I would get on calls with people from other states that spend a lot more money on education, public ed, than we do. And it was just interesting. They'd say, I mean, it had been 3 or 4 weeks and they hadn't even begun any type of distance learning. And they were wondering how on earth we did it and how do we reach those rural students. But what do you do in the districts that aren't close to your urban areas? And I think we forget sometimes what a great system we have with UETN and the broadband access that we have. It's not perfect. We learned a lot about areas that we need to do better in areas like in homes of people that don't have access. And I'm glad that Ray had talked about addressing that. But overall, as a state, we're a very connected state. The resources that we put into UETN and the way that UETN's manage those resources is just exemplary. And I cannot thank you enough and tell you what a difference it's made for our students during this time. So thank you.
Wonderful. Thank you, Tammy. Anything else? Well, hearing none, I would entertain a motion to close the meeting.
So moved.
Is there a second?
This is Laura Busby. I'll second that.
Thank you very much. All in favor, please raise your hand. And guess what? That also serves as a goodbye. Okay, thank you all very much. I wish you all best of health and a good rest of your summer.
Thank you. Thanks, everyone.
Yeah, thanks, everybody. We sure appreciate it.
It's good to see everybody.
Kelly, do you want to initiate the call?